Thank you very much for joining us all. My name's Paul Willis. I'm a professor in social care at Cardiff University, and I'm director of our Centre for Adult Social Care Research, hosted by the School of Social Sciences. And in CARE, in my centre, we work with Exchange Wales in curating this webinar series. And I'm really delighted to welcome everybody to our first seminar in this series focused on dementia support in a diverse world. So we have a series of 4 webinars under this conference theme of dementia support and diversity and equality. And I'm really pleased to chair this very first session today and welcome you all here. So the format today, our presenters will speak for about half an hour, and then we'll have ample time for questions and discussion. If you think of a question as you're listening, please feel free to pop it in the Q&A box, and I'll keep an eye on that box and we'll come back to those questions after the presenters have finished speaking. And there'll also be an option for people to raise their hand and convey their comments verbally as well. So if you think of any questions, feel free to jot them down on a piece of paper or pop them in the Q&A box, and we'll come back to that. And we're also recording this webinar today as well, just so people are aware. So without any further ado, I'm going to introduce our 2 speakers today for our first webinar. So first of all, we have Dr. Becky Oatley. Becky's a researcher and lecturer on our MA Social Work Qualifying Program here at Cardiff University. And Becky previously worked as a social worker across statutory and third sector services for older adults and people living with dementia. And Becky's research interests include social work of older adults, diversity in the lived experience of dementia, post-diagnostic community-based support interventions, and translating research into practice. And Becky is also a member of our Centre CARE. And presenting with Becky today is Becky's colleague on this particular research project, Thomas Morton, who's joining us from the University of Worcester. Welcome, Thomas, and is a research associate and project manager of this particular project. So the topic today is wonderfully titled, Food, Glorious Food. So if you're feeling hungry, then hopefully, well, if you're not feeling hungry, maybe by the end of this session. So this topic is all about investigating the benefits and challenges of offering food in community-based support groups for people living with dementia. And I'll hand over to Becky to tell us more about the project. Thanks, Becky.
Thanks, Paul. Okay, so hi everyone. Thanks very much for coming, and thanks, Paul, for your introduction. Today, I'm really excited to share with you some insights about the NIHR-funded project that we're doing, as I said, Food, Glorious Food, of which I'm a part, and Thomas is here, who'll be able to answer questions as well. So the session is really going to kind of introduce the project and its rationale, really exploring the potentially important role that food can have in dementia support, beyond simply thinking about kind of nutrition and hydration. So to begin with, I'm going to start very briefly by kind of outlining the project, outlining the team, and I'll return to say a little bit more about the methodology and the methods later in the presentation. But the project is really centred upon this research question. So what role can food-related practices play within community group support for the holistic well-being and personhood or citizenship of people living with dementia and their family carers? So it's looking at kind of what works, for whom, in what circumstances, and why. And I suppose just to be kind of clear about the context of what we're talking about, this project is very much focused on people living outside of residential care or living outside of nursing care. It's very much focused on kind of local in-person group support that's usually attended by people living in their own homes. And we are very purposefully targeting diverse ethnic groups in our sampling, and I'll say a little bit more about that later. By food-related practices, we take a very kind of broad position. That means obviously eating, drinking, but also cooking, making food, sharing food, serving food. It includes things like food and drink related activities, meals, snacks, clearing up after food, shopping for food, food choices, and so on. Everything kind of around the food and eating experience. I guess what we're not really talking about here, what we're not particularly interested in, is actually nutrition in the sense of like calorie intake or vitamin intake or kind of physiological status. It's very much from that broader sort of food sociology perspective. So exploring the food choices, the eating habits, the role of food in identity and how that kind of relates to maybe culture, power, gender, disability, and so on. So our goal really is to understand how food-related activities within support groups impact people living with dementia and their carers from diverse backgrounds. And as I said, it's this kind of what works for whom and in what circumstances. As Paul's already kind of alluded to, this project is a collaborative effort across multiple institutions. So it's led by the Association for Dementia Studies at the University of Worcester. Obviously also includes me here at Cardiff, Karen Jutler at Wolverhampton, Jeff Wong at Oxford, and Nigel Huller, who's part of the Three Nations Dementia Working Group, who I suspect some of you in the audience are probably quite familiar with. The project also includes and is very much informed at every stage by our Experts by Experience Advisory Group. So that's a group of people made up of people from a diverse range of backgrounds with different perspectives, different experiences, and it includes both people living with dementia and people in caring roles, whether that's formal paid kind of capacity or whether that's informal unpaid capacity. So before I go on to talk a little bit more about the kind of progress that we've made so far in the project, I just want to delve into a bit of the kind of rationale a little bit as kind of why does this matter? Why does the Food Glorious Food project matter? There are currently it's estimated around 982,000 people living with dementia in the UK. And I'm sure you're all kind of well aware that this number is predicted to continue to rise. In particular, research into minoritized ethnic groups shows that or suggests that they may be more likely to develop dementia. And the number of people with dementia in minoritized ethnic groups is projected to increase sevenfold by 2060. So that's a much quicker rate, much faster rate than people of white British ethnic groups. Approximately 2/3 of these people living with dementia live outside of residential and nursing care. And I'm sure probably a lot of you are aware that many people express a preference to remain living in their own home for as long as possible. And certainly the combination of that and kind of broader policy points to a need to move towards a model of sustainable social care. And I mean social care in the broadest sense, where people are supported to live as well as possible at home. Certainly improving provision of support for people living with dementia and their families is a priority for Welsh and UK policy. And I think that, I guess our position is that community group support in its very many guises, so that might be dementia cafes, it might be day centres, it might be meeting centres or other kind of more local groups, is really key to kind of public health approaches and very much aligns with a global mission, really, I suppose, to enable people to live well with dementia in their own communities. It is certainly true to say that food-related practices are often a feature of these community groups, and yet actually very little is understood regarding how best to facilitate such activity to really kind of, I guess, get the most out of it to maximise well-being for different people living with dementia. What little research does exist around, for example, dementia cafes is it only really has a very cursory mention of food or refreshments as part of a description of the group. It rarely, if ever, actually looks in any more detail about that and how the kind of food-related routines or norms might play a role in creating the culture or the structure or even the kind of social roles or dynamics within the group. So thinking a little bit more about kind of food, eating and dementia, it's certainly very well established that many symptoms of dementia can affect the eating experience, which in turn can obviously affect people's quality of life, not just for the person living with dementia, but also their family or carers. Symptoms are very well documented across kind of literature. So, for example, things like changes to appetite, maybe not recognizing appetite, changes to taste or taste preferences, agnosia, which is the kind of changes or inability to process sensory information, dyspraxia, so issues with coordination, changes to attention, changes to task sequencing, memory, decision making. All these things can create difficulties when you're buying, cooking, preparing, and eating food. And as symptoms progress, it's also not uncommon for people to experience issues with swallowing as well. Loss of inhibition and changes in behaviour can also create real challenges, but particularly for the person or their companions when they're eating socially, maybe when they're eating in a group, which in turn, I guess, potentially could affect people's willingness to access group-based support, where eating together might actually bring with it almost a risk of exposure or a risk of embarrassment, depending on what kind of symptoms you're experiencing. It is also very well established that the risk of malnutrition and dehydration are especially high in older people with dementia. Whilst, as I've already noticed, we're not really interested in nutrition and hydration so much. Clearly, you can't get away from the fact that a healthy and balanced diet is an important part of maintaining physical and mental health. Yet, the role of food in daily living often goes far beyond nutrition, arguably impacts sort of psychosocial well-being, citizenship, identity. Some very simple examples would be things like eating comfort food or celebratory meals, perhaps. The fact that this has so far been sort of overlooked or otherwise almost completely dominated by physiological sort of health-based research, that focus on malnutrition and dehydration, perhaps speaks to the kind of continued both sort of problem-focused and medicalization of people living with dementia. This is perhaps a little bit of a tangent, but when I describe the sort of research I do to people, or that didn't come out quite right. When I describe to people the sort of research that I do, I tend to say that I'm not really interested in working out how you're going to live as long as possible. What I'm interested in is working out how to support you to live as well as possible. And of course, if you do that well, you probably live longer anyway. But I think that fits really well with this project. It's not about just thinking about how much food you need to sustain the body. It's very much about how food can work to sustain quality of life and all the things that come with that. So certainly, in this project, we kind of draw on food sociology that talks about the fact that food can hold very deep social, emotional and cultural significance beyond just nutrition. And I think it holds kind of real potential, perhaps, in supporting a more holistic view of well-being than those kind of crude physiological measures might sometimes indicate. If I haven't already persuaded you why this is an important project, just a little bit of, I guess, further rationale on why this topic matters. Drawing on a little kind of flavour of evidence from non-clinical populations, pardon my pun there. What you will discover if you work on a project related to food is it's very difficult to talk about it without making food-related puns. So yes, a little bit of a flavour, a little light bite from evidence of non-clinical populations. There is evidence that suggests that people that eat together socially are suggested to feel happier and have higher life satisfaction. In addition, social eating initiatives, and by that I mean sort of community-based food services, can provide opportunities for things like sharing knowledge, fostering relationships, developing a sense of group belonging. So really kind of supporting that sense of well-being beyond nutrition. Evidence from lunch clubs for older people in the UK have been found to improve nutritional intake, but also have that really positive impact on socialization, on loneliness, and provide pleasure too, which all three I think are really valuable outcomes that are often listed by people living with dementia in relation to kind of quality of life. So food can be this kind of tool for reducing socialization, for building connections and relationships, and really in I guess kind of potentially engaging groups of people and developing a shared sense of belonging in them. I think certainly we'd argue that the social or the kind of the social, emotional, the cultural significance of food and related practices is pretty well established, but actually much less so for people living with dementia, which leads us neatly into the gap that this research is trying to fill. So, as I've already alluded to, the vast majority of research for people living with dementia and food focuses on nutrition and hydration. There is also a little bit in relation to people living in care homes, perhaps again sort of reflecting that sort of medicalization, but also the sort of maybe the stigmatized stereotyping of what it means to be living with dementia. Very briefly touching on what the care home literature says about meal times, there is some suggestion that eating together or what they kind of call family style dining can offer benefits and challenges. So benefits might be an example that eating together can offer opportunities to reminisce about the particular food you're eating. So it's kind of encouraging social interaction in that way. But there's also potential benefit in what they describe as a sort of copycat eating, meaning that if a person is sitting in a group, even if they maybe are not getting sort of obvious social interaction from it, they may be more likely to eat, and the kind of theory is they're sort of copying the other people eating around them. Perhaps not surprising at all, as with many other areas of dementia care, there is obviously a need for quite careful tailoring for different people with different preferences and different symptoms of dementia. I guess we will certainly expect to see some of that in the community-based groups that we go out to as well, where we see people with a huge range of stages and symptoms of dementia. Faraday's systematic review of good mealtime care in care homes also found that mealtimes were a really important opportunity to foster that social connection, but again found that tailoring the care, the choice, and specifically having a very sensitive response to food refusal were also really important aspects of good mealtime care. As I've said, that there is considerably less research outside of institutional settings regarding people living with dementia, but it is true to say that anecdotally, certainly I've come across quite a lot of people who talk about the potential benefits, and actually it's true to say that part of this project certainly stemmed from anecdotes shared by people living with dementia and their families in dementia cafes. So in particular, in the immediate wake of COVID-19, when dementia cafes were just starting to restart, people at groups certainly told me how much they missed the previous food provision, the important, I guess, the important role they felt that it had in bringing the group together. And the real challenges that some of the sort of post-COVID hygiene restrictions had in the kind of wake of the pandemic. So sort of very simple example would be a group who used to have a kind of cold buffet, help yourself. And when they came back, it was kind of a plate of wrapped biscuits, penguin biscuits, and just saying that this was just a completely different experience and kind of atmosphere in the group. Alongside those kind of anecdotes, I guess some findings from research undertaken by Worcester are also particularly relevant to the development of this project, kind of indicating the potential importance that food provision might have in that group setting. So findings from the SCIDEM Realist Review, which I'm sure if you're interested, Thomas can talk more about, but this looked at the sustainability of community-based activities for people living with dementia and family carers. And that reported that the opportunity for kind of communal eating, shared eating, was a factor in widening the appeal of groups to new members and in encouraging people to come back again. And a similar finding was also reported in their Get Real study, which was exploring the sustainability of meeting centres specifically. And I guess for anyone who's not familiar with the meeting centre model, it's a very specific model of community-led social group intervention for people and families affected by early stages of dementia. But yeah, I guess so there is, as yet, there is very kind of limited research regarding the experiences of people living with dementia in the community in specific relation to this kind of eating together or the experience of food. And the issue of that, I guess, really is that a lack of research means that there is very little evidence, robust or otherwise, to inform people running those groups about whether they can, whether they should offer food, and actually how best to do so. So I guess kind of drawing this all together, some of the implications certainly from food sociology, from the non-clinical kind of evidence, from care home mealtime populations, as well as taking into account the potential impact of sort of different dementia symptomology. There's community groups that include food-related practice within their activities may be creating significant psychosocial benefit for those attending. But doing so might also actually be very complex, perhaps. It might be very challenging, particularly when you have a group with very diverse strengths, very diverse experiences, very diverse needs. So this project, this Food Glorious Food project, is very much about trying to begin to understand that, okay, what works for whom, and understanding how these food and related practices might act as barriers and facilitators to accessing both group support, but also kind of, I guess, social eating opportunities for people living with dementia. Just want to make a little kind of note about why diverse groups. Within the project, we are purposefully sampling culturally diverse groups because of, I guess, in part because that's important, but also because of the recognition that food specifically and related practices can be a key symbol that establishes kind of different cultural norms. And so it can potentially be a factor in creating a sense of familiarity or a sense of belonging for different people. Clearly recognising diversity is crucial in dementia care, and within the UK, certainly as I've already said, as the numbers of people from particular minoritised ethnic groups are increasing at a faster rate than the white British population, this is kind of ever more important. It is really important to recognise how culture potentially can be created by these food practices. And I think it's important to say whether that's in relation to minoritised groups or in relation to majority norms. I think it's really important to say, like, we are specifically not only looking at minoritised ethnic groups, because I guess such an approach would really suggest that it is minoritised ethnic groups that create culture through food-related practices, but that sort of completely fails to acknowledge how white British culture can also be very embedded in food provision and in food practices, and therefore kind of can create a particular context that some people will feel more familiar with, and potentially some people will feel more welcomed in. It would obviously be naive to ignore the fact that culture obviously intersects with many aspects of identity beyond simply ethnicity. And there is also obviously diversity within as well as between cultures. And we're not making any claims that we are trying to explore every nuance of every culture here. Really, I guess our intention is to draw on different groups to cover different kinds of community-based initiatives, serving people from different backgrounds and communities with different kinds of offer, different approaches to providing food and related activity in order to try and provide or generate a range of information-rich contexts, perspectives, and experiences. So the Food Glorious Food project is taking a kind of realist evaluation approach. This is, if you're not too familiar with it, this is an approach that is about this kind of what works for whom in what circumstances. And we're really aiming to kind of uncover some of the cause and effect factors at play. How different contexts, and I mean by that the sort of background and circumstances, can trigger different mechanisms. So the kind of responses and processes from people and organizations, how they can then produce kind of wanted or unwanted outcomes. And really, essentially, I guess the realist evaluation method helps us to understand not just whether something works, but actually why and under what conditions it's maybe most effective or most likely to work. So I think the real benefit, and again, certainly Thomas can offer a lot more insight into this methodology than me, but it can help draw out findings that might be tailored well to interventions for diverse groups. Thomas, do you want to add anything there?
I was going to say, do you want me to say a couple of, because one thing I was going to say is this links to the previous slide, really, talking about different cultural groups or different groups with, from different cultural backgrounds and so on. This is precisely it, really. We're looking at what works for whom under what circumstances. And of course, we've already found that there's very different expectations and very different ways of doing things that may work for some people but not work for other people. And I mean, it sounds a bit glib, but that is, essentially that is the purpose of doing a realist evaluation, is to try and tease apart those different things. And particularly, I mean, yeah, I always say it's about cause and effect, but it's not cause and effect in a standard kind of scientific method kind of way. You're more looking to look at the kind of trajectories of theorizing how one thing leads to another, essentially, in terms of, as we say, context mechanisms within people and organizations to produce different outcomes, which may be outcome you want, or it might be an outcome that you don't want. But essentially what we're aiming to do at the end of this really is to say, if you were to do this kind of thing with food, then what that's going to do is people are likely to respond in this way or that way, or certain people respond in this way and certain people are likely to respond in another way, and that's going to produce this outcome. So if you want to do a particular community group for a particular community in a particular way, and you want people to come along and you want people to enjoy it and you want people to feel included and so on, then you may want to do this or you may not want to do that. So that's the kind of thing that we're looking for, really, that kind of nuance. And it's really, again, part of the kind of rationale behind realism and the kind of strength of it really is to look at how the difference between what you plan to do and what actually happens on the ground. And that's one of the key things that we're looking for. So you may have done a particular thing, planned to deliver food in a certain way or include food in a certain way in a community group, but does that actually work as you want it to work? And what are there any unintended consequences of doing that, and so on? And as I say, those we've already seen. We can go into it later, but in the data we've gathered so far, quite huge differences between different types of community and different types of community group as to what people will want and what people will expect and what people will make people feel included and valued and so on, or not. So it's very interesting stuff.
Well, thanks, Thomas. So just very briefly to touch on I guess, the methods that we're using. So we're using multiple methods, and our research design was always designed to be intentionally flexible in order to maximize the opportunity for different people living with dementia with I guess, different symptoms and different strengths to participate in the research in ways that kind of felt most appropriate to them or chosen for them. We are working alongside translators and community advocates as required to ensure that people's language preferences are also not a barrier to participation. And we've used, I guess, what I describe as kind of flexible qualitative methods to ensure that we are capturing this kind of wide and rich and diverse range of experiences. So it includes certainly using sort of ethnographic observation type research at 6 different community support group locations. So that includes some sort of traditional dementia cafes, some meeting centres in the sort of Herefordshire and Worcestershire area, where anyone familiar with the area might anticipate that a lot of the kind of attendees are likely to be white British. And then we're also including groups that are specifically tailored for Afro-Caribbean elders, and also some Southeast Asian groups in kind of different geographical locations. These groups also represent kind of, as Thomas has already alluded to, a variety of different ways of delivering food. So whether that's kind of a hot lunch kind of service, people bringing packed lunches, cold buffet snacks, sometimes a mixture of those things. And again, it's to really kind of try and build up a rich and diverse picture. But these kind of ethnographic methods involves going in, observing, experiencing, and really talking to people about their experiences within the group, how the food fits, how they understand it, etc. We are also offering people the more kind of traditional semi-structured interview if they prefer to do that, and certainly doing that with attendees and also staff and volunteers. As I say, it's really intended to mean that people can participate in the way that suits them best. There is also a kind of small work package that is going to explore with a small number of people living with dementia, a bit more about the kind of role of food a bit more broadly than just within the group environment. So being able to see a bit more how it fits into their sort of life, and maybe how that experience in the group relates to their experience at home, perhaps. This part of, I should say that this part of the data generation is still at a very early stage, but again, it's designed to be flexible, such that people can take part in the way that they want to. So it might be traditional interviews, it might be more of sort of maybe a go along style interview where you may be doing something with somebody whilst talking to them, or it might be using something like photo elicitation, whether that's researcher-led or participant-led. It is intended to be kind of creative. So I'm aware that we've spent quite a lot of time, I guess, kind of setting up the project, discussing the rationale. I think it's fair to say that we're probably maybe midway, maybe 2/3 through data generation. And certainly we've still got a lot of data generation and certainly a lot of analysis still to go. But I can talk briefly about some very kind of early themes and questions that are rising so far across the groups. And perhaps we'll talk a bit more about these in the Q&A as well. But first, that thing about understanding the role of food in community groups, as Thomas has already said, that can be really different in different contexts and with different groups. Beyond nutrition, it certainly it can provide structure in some groups, and actually for some people, it can be very little more than that. Actually, it is always important to remember that food doesn't hold big cultural meaning for everyone. It's not significant for everybody, but for others, it really is. It can also be that real kind of source of social connection, of emotional comfort. Groups are certainly using food in very different ways, from the kind of structured routine to really more of a kind of source of pleasure and a real central activity in the group. Food is also very much shaping kind of some of the social dynamics. So absolutely, I think we've seen evidence that it can foster belonging. It can be a part of somebody's identity, or particularly their food choices might be quite a part of their identity. But it can also contribute to stigma and exclusion, I think it's fair to say, particularly for those who might face difficulty with eating. People can sometimes feel judged for their food choices or their ability, I guess, raising some questions for us about actually how to ensure inclusion in food-related activities for different people. Although we didn't set out to explore nutrition, it would be remiss to pretend that health perspectives aren't important. I think that's certainly come up in some groups, and probably some groups more than others, is that some people attach almost a kind of moral value to food choices, that sort of sense of kind of good health and good diet. whilst other people might require adaptations to their diet. So that might be due to kind of dementia related symptoms. So for example, somebody who's not recognized that they've just eaten, and so they might carry on eating and overeat. So that has to be very carefully managed by perhaps their partner or staff. But it might also be related to other conditions. It's people living with dementia often have comorbidities, and certainly something like diabetes might also need to be, I guess, kind of managed or controlled by their partner or maybe a member of staff, depending on their strengths and needs. But I guess that those kind of issues do require very sensitive support, or potentially risk exposing somebody, as I kind of alluded to earlier, and you could almost call that sort of managing the stage. Food can certainly be a connector. It can unite people, but I think it can also reinforce divisions potentially. So in some settings, the act of serving or preparing food can kind of delineate roles between, I guess, separating the almost the carers from the cared for, if you like. So understanding a bit more about when food might foster togetherness versus when it might kind of at the most extreme, almost kind of create and reinforce a hierarchy, is an aspect of group dynamics that absolutely needs to be considered and attended to. And I think regulation and risk management certainly present some further challenges. Some groups and some people have expressed concern about food provision becoming almost overly formalized, potentially leading to a sort of almost an institutionalization of the food context. And I guess that sort of links with some of that stuff around creating hierarchies, perhaps. Whilst clearly regulation is important, it can lead to reducing choice. It can potentially affect spontaneity and, I guess, potentially undermine almost the kind of social normalcy that groups might be aspiring to create. Although I haven't included on here, I think there's maybe also something in relation to the importance of kind of hot and cold food, or the types of food, the ways it's presented, things like the crockery, the cutlery, tablecloths, that might sometimes have both a kind of very, very practical reason. So something like a tablecloth might be a really important contrast for people between the plate and the table, but also might have symbolic relevance for some people around the sort of style of presentation, the style of the experience. So looking ahead then, as I've said, our data generation is certainly not complete, and analysis is far from it. There are currently works in progress. But looking beyond that to, I guess, our kind of pathways to impact, we will be co-producing guidance, as Thomas kind of alluded to, with our Expert by Experience group. And certainly if that's something that you're interested in or you think would be useful, please don't hesitate to get in touch, and we can certainly keep you updated as and when that becomes a real thing. We will be disseminating these materials via various dementia support networks and the community groups, as well as a bit of kind of awareness raising. And I guess with the kind of overall aim that this project will have impact by creating or contributing to kind of widespread appropriate food-related practice in different community support groups that engage a diverse range of people and contribute to beneficial community support that really supports people's holistic well-being, quality of life, and inclusion as well. I think that's all I've got to say. So there's some references there. Thank you very much for listening. Thank you also to Paul for chairing, and also just thank you to those behind the scenes in Care and Cascade for doing all the organising.
Thanks very much, Becky and Thomas. Lots of food for thought. Hey, you had to get a pun in there. But definitely lots to think about. A really, really interesting presentation. I've got a couple of questions, but please don't be shy in the audience. Feel free to pop questions in the Q&A box or raise your hand. So while other people have to think about their questions, I'll put my two questions out there. The first one is about, are you going to explore, I wondered about the ways in which particular food practices and particular types of food might evoke memories, and how that might how you might bring that together in terms of like reminiscence activity. That's my first question. And then my second question is, will your research explore some of the barriers and challenges um, around shared eating? So, for example, I'm thinking about partners and carers who might experience some degree of embarrassment about the person, their significant other, about the ways they participate in the meal, particularly if the person, isn't following the kind of the social norms expected of within that particular group or particular setting.
Yeah.
So 2 questions. Yeah.
Thomas, do you want to kick off?
Yeah, certainly. Yes. Well, sorry. Could you repeat the first one again? Because I was thinking on
First
that,
one's
and then I
about-
went off on the second one.
No, that's right. The first one's about, are you going to explore the ways in which particular food practices and particular types of food can evoke memories,
Yes.
and how that might
Yes.
feed into reminiscence work?
Absolutely. I think that's something that's already come up an incredible amount actually already. And I mean, it's one of these things that's so well. There's a couple of things I wanted examples I could give. One is that there was one group that we've been into where they actually it was not so much as part of the meal, but as part of one of the actual activities that they were doing, like a quiz basically. And the quiz was it was done with having objects, and so basically there's a basket full of objects, and each object had a question attached to it. I noted that almost half of the objects were food related. They were actually, so it's not necessarily just eating and drinking, it's also that food is part of. Literally there were questions about about superstitions, about things that people might remember, about health benefits of things, and they were all food items. It could be a tin of soup, or it could be some salt, and people would ask basically, and then people would get talking about the things that they associated with that as part of that activity. But I mean, more than that, really, it just kind of happens naturally. Particularly, I mean, as I say, we're going into particularly, well, we've been to a group that is predominantly the people who come along are from a Caribbean background, and it's absolutely every step of the way, everything that comes up, someone that has something to say about it. They remember, do you remember picking these on the beach in so and so, or do you remember when we used to have these when we were children? And even down to things like there was a conversation on health that took place because somebody, now this is nothing to do with the Caribbean necessarily, but someone kept on saying pass the sauce, and another person kept on adding Ari on the end, which was actually a memory of an advert from the 1980s with Frank Bruno in. I don't know if anyone remembers that, but pass the sauce Ari was a thing like that. And suddenly people started talking about Frank Bruno and that he'd had struggles with bipolar, and they were talking about what is bipolar disorder and how. And so you had this quite in-depth conversation about mental health that took place because of it, simply from a memory of an advert which was triggered by the act of passing the sauce. So there's an incredible amount of stuff around that, but particularly what we really found is that that food is, you can't divorce it from people's lives. It is absolutely everything that, anytime anyone is interacting with food, they're thinking about the last time they had this food, what they think about it, what they feel about it, whether this reminds them of home or whether this is strange to them. And all of these things will generate conversation, and people will talk about them. And so yes, and I think what we've particularly found is that it is a factor in marginalization. That if people don't have access to the things that are familiar to them, they're instantly put in a position where they feel marginalized. They don't feel like this is for them. They don't feel like this is home. And if there's something familiar there, it can be a really simple thing, but it just puts people at their ease automatically. So there's some really interesting stuff around that.
Yeah. Do you want me to take the second part? So the second part was about, if I'm right, Paul, the sort of barriers and challenges around the sort of shared eating experience, and particularly when people are maybe not able to follow social norms. And I think that we certainly have picked up some of that stuff from the kind of observations in groups. I can think of an example of where it was quite sensitively dealt with, where a woman was struggling to use both a knife and fork. One of the staff noticed and just sort of quite quietly removed, helped mash up the food, and said next time we maybe need to cut it up and just give her a fork. this was quite, as I say, this was quite sensitively and quietly dealt with. I guess what it's fair to say a limitation in this project is what we're not necessarily talking to is anyone who has been to a group and had a difficult experience and then not come back because they've been embarrassed about it. We might pick up some of that from talking to staff and volunteers, potentially, or even attendees who kind of remember that. But I guess it's fair to say that's probably a limitation of it. But I think we will continue to pick up those little areas where it's dealt with well and areas where it's maybe dealt with a bit less sensitively. So I guess an example where I can think of where it was maybe a little bit less sensitive was somebody who had diabetes, and the sort of combination of her diabetes and memory loss made it quite difficult for her to manage her own diet. So and she was quite open about this and was supported by staff to do that. But there were kind of multiple occasions where the kind of biscuits would come out or tins of chocolates would come out, and maybe everyone was offered one and it kind of got to her and she was offered, and then it was sort of whipped away and sort of, no, you can't have that. So I think all of these things need kind of just thought and care in kind of managing so as not to either embarrass somebody or to mark them as somehow different. Within that group.
I was going to say that's something that I mean, it is, I think, a matter of just the person-centeredness of it. It's being, very aware of that particular person and how they're feeling. But it's hard to know sometimes how people are what they're making of what is happening, because I have seen examples of generally speaking, anything that any kind of special attention to someone is handled very sensitively and very low key, and no attention is brought to it. But one practice that I have seen across different settings is that if somebody does have trouble eating, they're often sat on a table together. So you have the people who have trouble eating and need extra help for a couple of reasons, but the main one really is so that a staff member can go there and help people, or a volunteer can help people, and usually that's fine and everyone's okay with that. But I have picked up a few comments of saying that other members sometimes feel a little uncomfortable, or someone saying, well, we had to sit so and so over there because the chaps over here, they don't like it because they're sitting on the same table as them because it puts them off their food or whatever. And you think there's some sensitive stuff to manage there, really, because that could be quite, that could become quite stigmatizing. So yeah.
And I think that feeds well into Sophia's question here about, have you encountered any examples where shared eating didn't work well? You've just given one example there of people being separated around how much support they need, and the potential stigma attached to that.
Yeah, I think, there's another example that I've seen is where a chap just didn't eat. He just obviously didn't want to eat, so he was sat at the table and had a plate of food in front of him, and he just wasn't hungry. So, and obviously, he wasn't just left like that. So that people did, various members of staff and volunteers came along and said, "Oh, are you okay?" And he was just like, "Yeah, I'm just tired." And so what they did, it was just basically cover over his food and take it away and say, "You can have it later." So he did. I have seen a couple of examples where people have eaten outside of the meal time. They'll then give someone a plate of food in a separate, or in the kitchen, say, at the table, either before or after the main meal. So there are definitely examples, but again, it is accommodating. To some degree, you can say that they're not deliberately excluding somebody; they're actually accommodating that person's wish to eat when they want, away from the main group. And I have encountered more than one attendee coming along to the groups who said that they're not really bothered about the meal, that they're not really there for it. They'll eat it, or they'll try and eat it, but they're not actually going along for that, which is almost the opposite of what other people are saying. Other people will say, this is why we come to this. So so you have to remember that obviously not everybody is really into social eating. I don't know, there was one chap particularly as well, despite a hot meal being offered during the day, who always brings his own packed lunch. And I find that quite interesting, because he sits still with everybody else, but he was telling me that essentially all his life he's been a worker. Basically, he was on the road basically when he was during his working life, And he said, I always had my packed lunch. That's how I ate. I would, I'd take my packed lunch out with me because I wouldn't be anywhere near a canteen or anything like that. And he said most of the other people in the group generally come from professional office work backgrounds who may have had a canteen or something. So maybe that's why they're more, used to having a hot meal in the middle of the day. But he said, I don't have a hot meal in the middle of the day and I don't want one. And I'm not going to change my habits now. So he will bring in his own packed lunch and he will eat it. So that's quite interesting, and again, I think that's an interesting thing we found on the hot food issue is very split, and to some degree it's cultural, but not completely. In that there are some people who will actually find some people really, if they don't have a hot meal in the middle of the day, and it's like, well, this isn't even a social exercise. What on earth are we doing here if we're not having a hot meal? Other people will actually feel a little bit like it's too much to have a hot meal in the middle of the day. That's not what they would normally eat, and actually they feel a bit pressured into eating it, and it might not be, it might then throw out the rest of the day because they would normally have a hot meal in the evening. So that's interesting to see that it's not one size fits all by any means at all, and I think that's something that needs to be paid attention to. We can't just make assumptions that because someone's from a certain background, that is what they're going to want. So yeah.
Thank you. There's a comment here from Hilary. Hilary works in the community of individuals. Individuals mostly are alone for meals and tend to eat sweet items and leave the savoury foods. Is there a way to encourage those individuals to eat a meal? And Hilary also comments that carers will sometimes sit with them and have a cuppa.
Well, oh, yeah, sorry, go on. I was going to say that it's something. This again, we've come across this an awful lot that that people tend to prefer sweeter stuff. It seems to be something that is linked to dementia. Actually, that people tend to prefer. Well, it obviously different types of dementia, but it's quite a common experience for people to say that. Oh yeah, I've got more of a sweet tooth now than I used to, or someone's partner to say yes, they now eat loads of sweet stuff whereas they didn't used to. One thing that I think we have found is that well, the people do tend to. There is a tendency for people to eat if they're sitting on their own on a couch with something on a tray in front of them. They tend to eat less than if they're sat at a table in a social situation. Becky alluded to that earlier on with the possibly it's a copycatting thing, possibly it's. It's just the social situation or the cues of actually being sat at the table. But that's something that we had, that I'd heard specifically from one of the groups that we've been out to visit, is that at home, people will just not eat much savoury at all. They will just literally have a few bites of a meal and say, I'm finished. Whereas if they're sat at a table in a kind of communal setting, they never say I'm finished. They might take a long time to finish it, and I think that's the other thing, is time needs to be allowed for people to carry on at their own pace, because it might seem like they're not eating much, but they will, a lot of people will just carry on. But yeah, that's an interesting thing. I don't know if Becky, if you've got anything to add.
The only other thing I was going to add was that what we have picked up a little bit of is people, particularly this is generally staff, saying to us that either family might say that somebody doesn't eat much at all at home, or they don't like this, or they're very fussy eaters, and then they come and eat in that kind of shared context, and they eat everything on their plate. They've got a really good appetite. And other examples of, people who just don't eat anything at all at home, but then in the centre, when surrounded by other people, will eat quite well. I know that not everyone has the opportunity to go to a group, nor they want to go to a group, so that's not necessarily a solution, but it does suggest that perhaps if carers are sitting down with the person, does eat better when there is company with them. That sort of all seems to be along the same kind of theme.
I think there's something about the table sitting as well, maybe or maybe not. It's hard to know, but because again, if you're sat down, well, one thing that we found as well is one of the reasons possibly that was suggested by staff and one of the carers at one of the groups is that it's not just the social aspect that makes people eat more. It's that when they're in that setting, they're more active. So if you're waking somebody up, if someone's sitting in a chair and you're waking them up to eat, often when people first wake up, then they don't have an appetite. So it's the eating after you've been active and been, and preferably sitting up at a table rather than in a chair, although I know that's not always easy for people who might have mobility problems, but yeah.
We're just about nearly out of time, so just one more question. I'll take this question from Emma. Will your research look at meal times in care home settings?
That's quite, I don't mind taking this one, Thomas. That's quite an easy one. So no, so our research is very much focused on community groups. So outside of care homes or nursing homes, there is a little bit of research that already exists around mealtime experiences in care homes and how to kind of deliver those. There are a couple of references in the slides which I think are being shared with anyone who's come today. So you can certainly go off and explore that. But no, ours is not that.
Although there's bound to be some transferable knowledge from there, but yes, we specifically focus on this because there is already some research around the care home setting, whereas there's virtually nothing on community groups. So yeah.
Fantastic. Okay, well, I know there are a couple of other questions, so maybe when people receive the slides, they could send their questions to Becky and Thomas to follow up and keep the conversations going. But it's just about 1 o'clock. It's just about my lunchtime. So I'm going to say a really big thank you to Becky and Thomas for a really fascinating presentation and important project. Thanks for sharing the emerging findings. We look forward to following this project and learning more about what you find. And hopefully you'll come back and present again to Exchange Wales down the line in a year or so and tell us more about what you've found and what some of the implications might be. So big thank you both. Thanks everybody for attending. Don't forget, this is the first webinar in a series of 4 webinars focusing on dementia support in a diverse world. And over the next couple of weeks, we've got other webinars about supporting LGBTQ+ people with dementia and supporting people with Down syndrome in terms of their diagnosis of dementia. So we've got 3 more great webinars coming up. So please feel free to register and join us. Thanks everyone. Have a wonderful afternoon.